Okay, today I am going to discuss about Pheniramine Maleate, that is the last antihistaminic drug. First of all, we will see the brand name. The brand name is Avil, and then we will see the dosage form in which it is formulated. So it is formulated in injection form as well as in tablet form. But in some of the cases, it can be formulated in the form of syrups. Then comes another thing, that is a dose. So mostly it is present in the form of 25 milligrams. But if you want to give it to the patient can take it half twice a day, or can take the full tablet of 25 milligram twice a day. Okay, and you can give 25 to 150 milligram of this dose once a day as well. Okay, then comes the clinical uses. Clinical uses are these, and you can see allergic rhinitis. Allergic rhinitis means it will cause a nasal cavity. Okay, it will cause a nasal cavity or the nasal mucosa membrane to get affected from the allergen. And in case of this kind of allergy, we can use the drug Pheniramine Maleate. Okay, Maleate is actually a salt form of the Pheniramine. Okay, then comes the motion sickness. In motion sickness, it doesn't mean only diarrhea. Okay, it includes diarrhea, it includes vomiting. Okay, or it also includes headache as well. Okay, so these are some of the things which are involved in the motion sickness. And then comes angioedema and urticaria. These are same thing. And eczema, this is also, these three things are same. Which one? This one, this one, and this one. These three are same. How these are same? uh, Due to the allergen, I will tell you the mechanism of allergy, and then I will explain to you that how angioedema is caused, how urticaria is caused, and how eczema is caused. Okay, vertigo is a state in which you'll feel a dizziness. Okay, and then let me tell you about eczema. Eczema is the bulging bulging of skin. Okay, and conjunctivitis, this is the inflammation of the conjunctiva of eye. Okay, due to which you may see your eyes bulging. Urticaria is the red bumps you will see on the body, red cracks, itchiness will be there. Angioedema means swelling of the skin. I will discuss these things later. Next, we have the contraindications. In case of the prostatic hypertrophy, or in case of the benign prostate gland tumor, you have not to use chlorpheniramine maleate. Okay, then we have the hypersensitivity. If you are hypersensitive to the Pheniramine Maleate, then you can't use it. Then comes pregnancy. So in pregnancy, if the condition becomes very severe, then you can go for the drug. Otherwise, you have to prevent yourself from Pheniramine Maleate. In lactation as well, and there is same case as that of the pregnancy. Okay, then comes side effects. Here I will explain in detail. Hyperthermia is simple. There is an allergen. Against that, we have introduced a drug Pheniramine Maleate, and it may displace a set point from 37 to upper temperature. Hallucination. Why it is effective against it is effective and it causes the hallucination. Let me tell you that H1 receptor These these receptors are present in heart. These receptors are present in the CNS. These receptors are present in the eye. These receptors are present in the GIT. These receptors are present again in the CNS. These receptors are present in the mouth, in the skin, and these receptors are again present in the CNS. Okay, so in skin, in heart, everywhere throughout the body, we have the H1 receptors. Okay, and if these H1 receptors are present in the CNS, you will get hallucination. Okay, because there will be no histamine effect, so there will be blockage of the H1 receptor in the CNS. So what will happen? AMP will not travel. Okay, and it will cause a hallucination, it will cause tremors. Okay, it will cause a nervousness and nervousness. That is a true term. Okay, these are the 3 points which are associated with the CNS. Now if I talk about the blood vision, you have studied the conjunctiva of eye. Okay, conjunctiva of eye. So H1 receptors are also present in the eye, so it affects the eye as well. You will not be able to see the things clearly. Okay, constipation, as I have told you before, that Pheniramine Maleate is used to stop the motion sickness. In motion sickness, we had one of the sickness known as uh, diarrhea. Okay, so in order to stop diarrhea, we use the Pheniramine Maleate, and if we go for the overdose, then it will cause a constipation. Then we have dry mouth. Okay, out of another thing, out of all motion sicknesses, we have one thing: sweating. So in sweating and in salivation, we use Pheniramine drug. So in case of the dry mouth, we will not use the Pheniramine. We have to stop its usage. Then next we have the mode of action. In mode of action, we will see H1 receptor antagonist. Okay, first of all we have allergen. Okay, it will come inside the body, and when it will come inside the body, we have mast cells. Okay, and it will attach to the mast cells. Then mast cell will release the IgE bodies, IgE antibodies. IgE antibodies. Okay, these IgE antibodies will be released, and release of IgE antibodies will cause the release of histamines. Okay, there will be release of histamine, and when there is release of histamine, it will go in the bronchioles and will cause the constriction of it. It will go to the blood vessels, endothelial, and it will cause the contraction of these endothelium and will cause more concave shape like that. Okay, which will cause increase in the fenestrations, fenestra spaces, and due to which we will see the increased permeability of blood vessels, and also there will be dilation of the blood vessel. Okay, due to increased permeability there will be plasma proteins which will enter into the layer between the skin and the blood vessels. So there will be accumulation of the plasma proteins or anything that is present in the blood. There will be accumulation there. Due to this accumulation, what will happen? There will be a bulging of the skin due to the presence of these substances, due to which we will see different things. Okay, so histamine has to bind with H1 receptor present in the endothelial cells, on the smooth muscles, in the bronchioles, in the heart, and everywhere in the body. So what will happen? Say for example, it is H1 receptor. Here we have histamine, and here we have the drug. Okay, this histamine has to bind with the receptor H1, but it will not bind because of this drug. This is Pheniramine Maleate. Okay, this will bind to it and will block this receptor. Hence, there will be no attachment of histamine to the receptor. This was a mode of action of the Pheniramine Maleate, and that is it for the antihistaminic drugs. Next, we will start the class of opioids. Hope you will enjoy it.